I'm really excited to talk about this one because this is something that a lot of people are doing their own research on, but actually there aren't health professionals really talking about it in social media, or they're not talking about it with their clients and their patients in their clinics either. I think it is a really poorly understood area, and in the last couple of weeks, I have been doing a bit of research into this area. I would absolutely love to share with you what I found over the last couple of weeks. Do they really work? Do they help to achieve type 2 diabetes remission? What are the risks? And why aren't doctors routinely offering supplements? And which ones should you be taking anyway if you are to take supplements? Will they be helpful on top of medications? Is there a risk of combining them? And do probiotics help with glucose control? The supplements that we're going to discuss include berberine, mulberry leaf extract, something called eriomin, one called cinnamon, another one called hesperidin, one called naringenin, and another one called inositol. First of all, why do we love supplements? Well, a set of academics put their heads together and looked at over 231 studies and looked at this specific question. And 84% of all the studies that they looked at cited that there were three main benefits, and they were the treatment of illness, the second is alleviation of symptoms, and the third is the reduced perception of side effects. And that's what patients felt when they were taking supplements. Well, my experience is that often people feel that supplements are more natural, and that being natural in itself may mean it's safer for the body and that there's less side effects. And they may also feel like they're treating more closer to the root cause of symptoms because it's seen as more of like a nutritional supplement. The concern is usually these supplements are not really subject to the same testing and clinical trial safety and quality compared to drug development by pharmaceutical companies. But some of these ingredients have been used in cultures for a very long periods of time. I can't definitely say millennia, but I can say for very long periods of time, hundreds of years, and are known to support conditions such as diabetes. What are they? Well, supplements, there's no formal definition, but I'd say it's essentially an additional substance into your normal diet. Essentially, they provide more nutritional value. They might come in pills or capsules or gummies or liquids, or they may be directly extracted and dried. They might be minerals, they might be herbs, they might be amino acids, which are different types of protein. There might be enzymes or other ingredients too, such as probiotics. We often think about taking them from a health perspective. For example, trying to prevent a condition or trying to help support a specific medical problem. And typically we wouldn't think of them as directly treating a condition, although some people might be thinking of that as well when they're trying to take certain supplements. We do have to be mindful with supplements. One is that quality and regulation issue. Because they're not specifically bound by the same legal requirements of medicines with development and production, it means that you may not necessarily be getting what you think you're getting, because lots more people can make this supplement or this substance for you and then put it to market because they're not subject to the same regulations. Secondly, there's a risk of overconsumption. Just because it's a supplement and it's an addition from a nutritional perspective, anything in the right dose, including water, can be a poison to the body. Taking more and more of something doesn't necessarily mean it's better. For example, vitamin A can cause liver damage in very high quantities, and we don't recommend it in pregnant women, for example. And too much iron can lead to gastrointestinal issues, and we also have conditions related to too much iron as well, medical conditions, and more of a supplement doesn't necessarily mean better. There can be interactions with medicines. Because we're ingesting something in our body, just because it's seen as natural or as a supplement or hasn't been subject to the same regulations, doesn't mean it can't have interactions with other medicines and side effects within the body as well. It's certainly not a substitute for a healthy diet, and it's not a substitute for all the diet and lifestyle things that you're doing. A blanket way of thinking about this, these supplements still do not treat the root cause. When I consider supplements with my clients and patients, I would consider them in this closer to medicines rather than treating the root cause. Some supplements will work in different ways. We'll talk about that. And of course, individual needs vary. So what you need and what dose you need is going to be different to someone else, just like medicines. I think we should be treating them as a form of medicine, especially if we're trying to get a specific health benefit that we would potentially derive from if we were taking a medicine for a specific condition. They don't specifically help with remission, but they can help to lower blood glucose. One of the things is, do they improve insulin sensitivity? And most of the supplements don't seem to improve directly insulin sensitivity. And that looks at a slightly deeper level compared to just bringing glucose into cells. Past that, we're not getting into a remission stage unless we're directly looking at some of the things that we think about for remission, which does include long-term caloric deficit, reducing fat in cells, when we know that weight is related to some people with type 2 diabetes. What should you be taking as a supplement? The answer is you don't need to be taking anything. But again, those are the ones that we're going to look into a few. And do they lead to a meaningful risk reduction in terms of lowering your long-term risk of complications? Well, I can't find any clear studies linking long-term complications related to diabetes, related to supplements in diabetes. There might be a number of reasons for that. One is quite clearly funding and getting enough data to derive that sort of information. But if you do find those studies, I would love to see them. Why aren't they routinely offered? I think that they're not routinely offered because as medical professionals, we're not taught about it. We're not taught about their potential role in helping people. The more and more I delve into nutritional science, the more and more I see things outside of typical medicines, the more and more I realize that doctors don't know it all. And we often are fed most of our information with supplements and medicines from pharmaceutical companies. When you see other people out there in social media starting to talk about things, and doctors are often being quite critical, often we don't have the full picture and we haven't had the years of training with those supplements, for example, as we might have done with diabetes medicines. Or we may not have the training when a new medicine comes out and all the information that tends to happen through studies and clinical trials that we get access to be able to make safe, clear decisions. I do appreciate it. I do understand when clients go and seek alternative advice from alternative practitioners. You just have to be careful with the training they've got, the credentials they've got, the experience they've got, and making sure that they understand that things could also interact with your medicines and they're not stopping you from taking medicines too. Let's talk about some of these supplements. We're just going to start with talking about berberine. So berberine is not commonly found in foods and certainly not commonly found in Europe, and it's derived from a Chinese origin plant where it's found in small amounts. How does it work? It works in a number of ways, increasing cellular glucose uptake, which can be seen as sort of increasing insulin sensitivity, reducing glucose production from the liver. It helps to shift cells into breaking down glucose to energy instead of storing it. And like I said before, it reduces the absorption of glucose generally, not just at cellular level, but also when we're eating it. A meta-analysis is a gold standard type of study looking at multiple other studies. So most of the studies, or in fact all of the studies that I looked at, were from China because this is a Chinese derived herb and it seems that most of the studies are coming from there. But within the meta-analysis, they may have looked at other studies from outside of China too. They found that it did lead to a significant drop in blood glucose when people were taking it regularly. The drop was 0.82 millimoles per litre. Now there's a number of different ways in which we measure blood glucose, and comparing the different units can be really confusing. But just to give you a rough comparison to other units, in European terms, that would be roughly an A1C drop from 49 to 44 if it was an average A1C drop over 3 months. But this is looking at specific blood glucose levels. Or from a DCCT, which is a percentage, that would be a drop from, say, 6.6% down to 6.2%. What I can't tell you is that where was the spread of people in these studies. The higher your blood glucose level, the more ability you have to drop your blood glucose level with smaller doses. Let's say these were very high blood glucose levels to begin with, then the impact on the blood glucose levels would be higher than if they were, say, pre-diabetic, and would be much smaller increments in terms of improvements. How much do you need? Well, the studies tend to look at 0.9 grams to 2.4 grams per day. Supplements are typically available in 500 milligrams, so 0.5 grams, or 1000 milligrams, 1 gram doses. Looking at the half-life and its activity, it's likely to be active in the bloodstream for a few hours after taking it. It does impact on insulin sensitivity, but only temporarily. So it needs to be taken, continue to have an impact. And that's the key thing here. That shows that this is not about leading to remission. A supplement that you are taking regularly can be seen as the same as taking a medication regularly. Ultimately, from my perspective as a doctor, if I'm giving you one supplement or one medicine and they're having some impact on your blood glucose level, if you're taking it regularly, we're not getting down to the root cause, but we're still helping to lower that blood glucose. What about the risks? Well, the meta-analysis that looked at over 2,500 patients didn't identify any major organ-related side effects. But again, are people definitely reporting side effects? One would hope that because of the way that they've looked at these studies, they would have got a reliable answer on this. But I wouldn't view berberine as necessarily safer than a medicine. And we, of course, still need to treat them with the same caution as medicines. Berberine, I would say it seems like it has a pretty significant impact. Mulberry leaf extracts or mulberry leaf. Well, where does this come from? Also from Chinese medicine, traditional use in Chinese medicine, and from the leaves of the mulberry tree. It also works by a number of potential actions, and I say potential because, again, fairly poorly understood. But one includes slowing down the absorption of food into the bloodstream, increasing insulin activity, reducing glucose release from the liver, also potentially as an antioxidant. And what we do know is inflammation within the body can be a potential risk for increasing blood glucose levels. It may help from that perspective too. There are some interesting results from mulberry leaf, and one study that I looked at 615 participants, and they found an average A1C fall of 2.92, so nearly 3 millimole per mole. If you were looking at that from an A1C perspective, if 48 is type 2 diabetes, that would bring someone down from 48 down to 45 into the pre-diabetic range. Now this sounds pretty amazing, but again, you need to be taking this really regularly. There are some side effects, mostly gut-related side effects such as diarrhea and bloating, but for most people, it's tolerated quite well. And so people normally take it in capsules, and typically they would take it between 1 to 3 times per day. One of the drawbacks of the study is that they didn't clarify the differences in the dosing. So I can't tell you whether most of the studies were taking a high dose or a low dose. And again, this seems to be a bit of a gap within studies when I'm looking at them from an academic perspective. And the dosing range of these studies was between 600 milligrams to 2,500 milligrams per day, but that at the higher doses, it was also stated they wouldn't be taking all of that in one go. They would be splitting it during the day. So number 3, eriomin. What is it? Well, this is a patented product, and it's derived from citrus flavonoids. And flavonoids are substances that are typically found in colourful fruits that are known for their antioxidant and potential anti-inflammatory properties. So it's marketed at helping to reduce and prevent prediabetes and generally to help with blood glucose control. Now, this is where I get nervous because now we're talking about commercially patented products, but I'm going to try and keep to the facts. So the impact data, and this is a product that is actually in other supplements that are well known out there, but looking at the impact data, one study suggests a reduction of about 1.5 millimole per mole in 2022, which was not seen as significant, and a second in 2019 as 1.16 millimole per mole drop. There is some lack of clarity with who was paid for the studies, how the studies were funded. That makes me a little bit nervous on the impact of the studies. So ultimately, what do I think about eriomin? I think a drop of 1.1, which is sort of about less than 0.1%, and probably in the studies they were taking it very regularly, and because it's a very new substance, it's probably something that I wouldn't recommend to my clients and patients, but it is something that you could consider, and it's something that's quite new in the market, and there's ongoing studies with it. Cinnamon. Most people know about cinnamon. Some people love it, some people hate it. I love it as a taste. So it's a spice commonly used in cooking, and many people who maybe listen to this back will have used cinnamon in their cooking too. And so it helps in a number of actions too, so increasing the glucose uptake, mimicking insulin activity, affecting glucose metabolism, including the prevention of glucose release from the liver into the bloodstream. Similar to some of the other supplements that we've just talked about. So one of the studies has reviewed multiple research papers totaling 1,100 participants. They found a small reduction in A1C levels by up to 2.6 millimoles per mole, and they were taking it as a supplement rather than in the cooking. So like all the others, you need to continue taking this to have an impact, and it doesn't seem to have an impact on insulin sensitivity directly, and there was no impact on weight change, which would tell me that it's perhaps not looking deeper at some of the underlying factors for some people with type 2 diabetes, that being weight. It depends whether you're using a powder or capsule in terms of the dosing, and looking at the clinical studies that are reviewed on the studies, cinnamon powder was between 1 to 6 grams per day, and cinnamon extract was between 0.12 to 0.5 grams per day. So you can see where this is getting confusing. You could pick the wrong type and then end up taking the wrong dose. And certainly it seems sensible to put cinnamon in your cooking when you have the opportunity to. It seems like this could be something to consider. It's been used for a long time. We know it's a food that we've been eating and consuming for a long time. So certainly something to consider. Number 5, hesperidin. This is another flavonoid extracted from fruits, including lemons and oranges. And there were 318 people reviewed in one study that I looked at, and that didn't found a significant impact on blood glucose control. There was a small reduction of 0.4 millimoles per mole. And again, this supplement is in other mixed supplements out there, some well known. And again, this is not something that I'd be recommending. So now you start to see that not all supplements are necessarily helpful here. Some are more helpful, some are less helpful. And certainly I'm not going to give you the full list of supplements here because there are just so many. Number 6, naringenin. This is another flavonoid found in citrus fruits, and there isn't clear data in human subjects, and there is data from animal studies to suggest there is some potential impact. Again, this is available out there and people are taking this. I, having looked at everything, don't recommend this. I don't think there's enough data out there. It hasn't been fully tested in humans. We don't know the answers in terms of the risks, the side effects, all of that. So something that maybe you just want to be careful of if you're taking it. I know some people will swear by their supplements. So if you're doing something and it's working for you, I'm not telling you to stop. And certainly I'm definitely not giving you specific medical advice today. This is just a general overview of supplements generally. So the final one is inositol. So this one is actually really quite interesting. The reason I'm interested in this one is because it hasn't been studied, that I can find anyway, very much with type 2 diabetes. Yet it has been used in studies a lot from gestational diabetes and also for polycystic ovarian syndrome. Both of these, which increase the risk of developing type 2 diabetes later on, increase the risk of insulin resistance, and especially with PCOS, can give people a baseline higher level of insulin resistance compared to the general population. So I find it fascinating that it hasn't been studied that much for type 2 diabetes, but certainly for the others it has. And it's a form of sugar that is found in small amounts in different foods. So this includes brown rice, legumes, nuts, and citrus fruits. And as with many other supplements, to turn into supplement is creating using industrial techniques to produce it in large quantities. So there's 2 forms of inositol, and when you look at the data, it seems as though if you combine both of them in a specific ratio, now you can't quote me for this one, but from memory, I think it is 40:1 of myo-inositol and then d-chiro-inositol, but you'll have to check that yourself, that then you get the best outcome. So it's also known as vitamin B8, but it's not a vitamin. It's a carbohydrate and a type of sugar. So its full mechanism of action is not fully known. It is known to lower blood glucose levels after eating and also at nighttime. And it does seem to impact on reducing inflammatory effects, which may contribute to weight loss. Maybe working at a slightly deeper level compared to some of the other supplements that we've talked about. They help in reducing glucose production from the liver again, and reducing fat accumulation in the liver too. Most of the studies available on the impact of inositol, like I said, are gestational diabetes or on patients with PCOS. And there are also some studies with type 2 diabetes, but not extensively. Looking at the safety profile, it looks like it's pretty safe. It seems online I've seen medical practitioners appear to be recommending this for PCOS, not in type 2 diabetes. And it looks like there was actually quite a significant shift in lowering A1C by 1 to 1.1%, which is actually quite a large amount. But again, I can't tell you whether this was in very badly controlled type 2 diabetics or people who are well-controlled type 2 diabetics. And it's a split between the different types of inositol, and it does still have calories, but it's very low amount of calories. As sugar, it's about 5 calories per teaspoon, and typically a supplement would be taken once or twice a day. So that one seems to be having quite significant impact compared to the others. So what if you took all of them together? Some of you might be thinking that. Don't recommend that. I really don't. Certainly if you can find a qualified practitioner who is used to talking about these supplements, that would be helpful. You do have to be careful about risk with side effects. I definitely recommend that if you're taking anything, you should speak to your doctor about it, let them know. Perhaps they have an opportunity to do a quick bit of research on it and they can check your specific individual needs. They may have access to literature that you don't have that might suggest that this is safe or not safe, or not shown to show much harm. There wasn't anything that I found about causing a very low blood glucose level, something called hypoglycemia, which can be an emergency. So I didn't find anything on that. Certainly, just be careful. Don't be taking all of these on your own. I would do your own research, get some advice from a medical practitioner if you can. And while I've given you some of the data today, you can't take my information as medical advice today. I definitely recommend you do some more reading if you're interested in looking at supplements. Now, the final one is probiotics. One of my clients has come to me recently and asked me, I found a probiotic and it increases GLP-1. Now, this probiotic is called Akkermansia muciniphila. They come with beautiful Latin names, all of these ones. And so again, I went away and did my research. I was trying to work out, how does this probiotic, this bacteria into our gut, improve GLP-1 levels? So essentially what it would do then, if it's increasing our GLP-1, is helping us to feel full. How does it do that? Well, it looks like it comes down to the production of short chain fatty acids, which are usually as a result of the fermentation process with bacteria. And we like, as human beings, we love short chain fatty acids. It's one of the reasons why probiotics are good for us. We can utilize it much better for energy. It helps with the quality of the gut lining. It may help to reduce inflammation in the body. There's a number of potential benefits of having more short chain fatty acids. Then looking back and say, well, if it's short chain fatty acids, let's look at the other bacteria that increase short chain fatty acid production. And many probiotics do it. But when we're thinking from a blood glucose level and trying to improve GLP-1 and then reduce blood glucose, it seems that it might not just be Akkermansia. It may also be other ones that are available in the market that are more financially suitable for some people to afford. So that might include Lactobacillus acidophilus, Bifidobacterium lactis, and Lactobacillus casei. And again, the data is really great in this. It's really, really unclear. There's people, I put this question to LinkedIn, so I've got a number of other professionals on there and we discuss these things. The general consensus is that probiotics may help, but the other consensus is that this is very early stage information. It's not absolutely clear whether this is going to have the biggest impact. The key thing is that if we're looking at supplements, they still do not treat the root cause to an extent. So they don't treat the root cause because we don't get these food substances in our diet in large amounts, but some of these are food substances like cinnamon. So one might say, well, that is potentially called treating the root cause because it's using our nutrition and our lifestyles to help prevent blood glucose from spiking and then causing long-term high A1C levels, then of course worsening diabetes. And then if you get that down, you might become pre-diabetic or non-diabetic. It still doesn't take away the fact that you need your nutrition right, exercise, well-being, sleep and stress, but they could certainly be an adjunct. For some people, they're going to be helpful. For others, they won't want to try this. It is a slightly lesser known area. Be careful, supplements don't necessarily mean safe. Some of the data I presented to you today suggests that they don't appear to have many side effects. I haven't talked to you about interactions with other medicines, and that would need to be looked at from an individual basis. Anyway, that was a different kind of talk today. I hope you enjoyed it and look forward to catching up with you on the next talk. And I haven't decided the topic yet. You'll just have to tune in or wait for the bulletins on that one. Otherwise, I hope you have a good Sunday and enjoy the rest of your weekend.